Hi, my name is Jordan. I'm Dr. Tal's nurse, and today we're going to be going over your pre-op instructions. We are going to go over your instructions for your upcoming tummy tuck procedure, and we're going to start with the medications. The first medication is the only one you have to take. It's an antibiotic just to prevent any infection after the surgery and while the drains are in. This medication will start the night that you have the surgery. You'll go home, rest, have something to eat, and at about 10 p.m., you take your first antibiotic. The antibiotic we call in if you don't have any allergies is Keflex, and it's every 8 hours around the clock until it's gone for about a week to 10 days, depending on when both of your drains are removed. If you have an allergy to penicillin, we will call you doxycycline instead, which is every 12 hours. The second medication is a pain medication. It's something called Vicodin. It's very strong. You only take it if you have a lot of pain and you really need it. If you don't have that much pain, the only other thing that you can take is Tylenol or extra strength Tylenol. The Vicodin is there if you need it. There'll be 18. You most likely will not need all 18, but they're there if you need it. If you are going to take the Vicodin, make sure you take it with food so it doesn't upset your stomach. The next medication is just a law in the state of Florida that anytime I prescribe the Vicodin, I have to prescribe something called Narcan. I've never had anyone need to use it. It's just a law in the state. It's used in case of an accidental overdose of the Vicodin. If you're unresponsive, somebody else has to do it for you and they have to call 911 anyway. And the last medication is Zofran. It's an anti-nausea. It's just 2 pills. It's there if you're nauseous from the anesthesia. If you are going to be nauseous, it tends to only last every 12 to 24 hours. So if you're nauseous, take it. If not, same as the pain medication, just get rid of it. Aside from those medications, the only other things that you can take are vitamin C, 1,000 milligrams a day, Tylenol if you need it for any reason, and arnica. If you are taking medication prescribed by your doctor, that's something that you discuss with our office and we go over before. You also want to make sure you avoid any vitamins or supplements, any herbal teas or juices or anything like that, anything on the medications to avoid paper that Martha gave you when you booked the surgery. And 1 week before, no caffeine and no alcohol. If you drink a lot of caffeine, try to kind of taper down off of it. So by the time you get to 1 week, you're having nothing. Also from here until we tell you otherwise after the surgery, make sure you're not doing anything that can cause an infection. Tattoos, piercings, laser, dentist, manicure, anything like that, make sure you avoid. For surgery, you can't have any nail polish on your fingers, so just make sure you remove that, but you don't cut your cuticles or push back your cuticles or anything like that. Toes are fine. You'll also need to make sure that you remove any jewelry or piercings and anything before you go to the surgery center. Make sure you leave that at home. That's very important. And then to surgery, you'll wear something very comfortable. For this procedure, you should wear the robe is the easiest because you can't have anything that's going to be tight around your abdomen and something that's easy to take on and off. After surgery, you'll come out with dressings and a binder wrapped around your abdomen and with 2 tubes on either side. Those are the drains. There's a separate video linked under this one that goes over what to do with the drains, but they'll look something like this with a skinny tube coming out on either side. You'll have to keep track of how much drainage you have in these drains. Every time you empty it, make sure you write down the day, the time, and how much drainage you have. They'll be squeezed like this because that's what's creating the suction. When you open like this, it will expand. You write down how much drainage you have on a piece of paper or your phone, and then empty it out. Before you close it again, you need to squeeze it and close this, so it's creating the suction. Now you might not have the same amount of drainage on both sides, that's normal. Your first follow-up for this procedure is the next day, and then you'll come again at around 5 days to a week, and depending on how much drainage you're having during your second follow-up dictates when we remove the drains. We remove one first and a couple days later remove the second. So it's very important to keep track of how much drainage you have during those days before you come in for that follow-up, and try to get at least one reading of a full 24 hours of the drainage. So for the first couple days after the surgery, you'll empty it whenever you feel like it's full. And then after a couple days, when you start to have a little bit less drainage, if you can, try to wait a full 24 hours in between emptying it so we know how much drainage you have in a full 24 hours. Now, after surgery for the first week, you don't want to pick up anything heavier than a glass of water, no heavy lifting or straining, and you'll be walking bent over. So you won't be able to be straight up until at least a week, possibly 10 days to 2 weeks. So you'll sleep at least for the first week with a couple pillows behind your back in a reclined position, and then a couple pillows underneath your knees, so you're kind of in a jackknife position. This will make sure you don't have any tension on the incision. For the first week, you can't get into the shower, so use a washcloth, baby wipe, wash your lower body, your armpits, but just make sure that you don't get the incision or any of the surgical area wet. We will guide you during your follow-ups on lymphatic massages. Dr. Tal usually recommends to do lymphatic massages after this procedure because it will help break up the scar tissue. You don't have to worry about this until at least your first or second follow-up. Dr. Tal will guide you on this. Usually he recommends at least 5 to 10, and the place that you go should tell you how often. You just want to make sure you're going to a good post-surgery lymphatic massage facility. And at about 2 weeks from the surgery, you can start to use a scar cream, which we have one in the office if you want to purchase that during one of your follow-up appointments. If you have any questions, just call our office or email me. I have my email here, and we look forward to having you for your in-person pre-op and for your upcoming surgery.